Good day, everyone. Doc Mika here, and this lecture video is the beginning or the first module for our basically third chapter of VSUR50, wherein we will be discussing wound management. All right. Before we actually make the wounds, before we do the surgery itself, we have to discuss how do wounds heal, how are they managed, and how do these factors affect how we go on our surgical plan. All right. And there are a lot of factors also on the patient side, which will affect our surgical plan. All right. So let's discuss first on what are wounds? What are the usual wounds that we will encounter in the clinic? All right. Not everything is a surgical wound na madali namang pagdikitan. All right. A lot of cases that come into the clinic are actual wounds, right? Doesn't matter how it happened, but yan ang common complaint ng kliyente. I think second to like diarrhea or vomiting, right? So this is, I believe, we will be having 3 to 4 lecture videos for this chapter, which will be the coverage of the second lecture exam. So let's begin. All right. Wounds are basically defined as any break in the skin or any layer of it. So go back to your histology. Ano ba yung mga layers ng skin from the most superficial? Mhm. You have the epidermis, then you have the dermis, okay? And then you would have the hypodermis or subcutis, which will be comprised mostly of fat and some collagen tissue. All right. So there are 2 categories or basic classification of wounds based on what layer of the skin has been severed or has been broken. All right. The open wounds, all right, would be an obvious break. You could see it, open siya from the outside. So there's an obvious break on the epidermal layer of the skin. And there are a lot of variations, kumbaga, of how these open wounds look like or how they occur. Right? You have incisions, lacerations, abrasions, avulsions, and puncture. Right? Now, going into the closed wounds, wala kang makikitang break from the outside, but a certain layer or a deeper layer of the skin has been broken. Right? The most common type of a closed wound would be a hematoma, wherein there could be a break of the dermis, wherein hair follicles and blood vessels and nerves are located. So there would be breakage of those blood vessels or any form of vascularity in that area, and that will cause a hematoma or what we call the pasa, right? So, I apologize if I don't have any animation for this. I am presenting through a PDF file. Basically, I want to create a new PowerPoint, but then I ran out of time. Sorry, guys. I'm currently studying for an exam as well, so it's really hard to balance the two. All right. So first, incisional wounds or yung what we call incision. Right. These are full thickness wounds, meaning the entire layer of the skin is cut. All right. Kaya siya full thickness. Right. And this is usually caused by a clean, sharp-edged instrument, like a scalpel blade, right, running parallel to the skin. Okay, the most common example of this would be the surgical wounds, which we do in the clinic or as a veterinarian during our surgical procedures, right? And since kumbaga maganda ang pagkaka-cut ng skin, usually ito rin yung madaling pagdikitin. All right? The wound is not caused by a very traumatic injury, kumbaga. So, madali siyang pagdikitan. As you can see, I'll try to annotate. As you can see, pantay, all right? Yung breakage from this side to this side and from this edge to this edge. So madali naman siyang pagdikitan by the common biomaterials that we have discussed. Sutures, staplers, For very superficial incisional wounds, we can use the tissue adhesives as well, right? Sorry. All right, lacerations, all right? As compared to incisions, all right, these are irregular tear-like wounds, and it's usually caused by trauma. And you could actually think of a lot of factors that could cause lacerations. Okay, very common for those, not just dogs and cats, but also in the farm animals. Okay, na sumasabit sa mga barbed wire na fences, sumasabit sa parts of the chute or parts of the called as restraining devices, especially if they are led to pasture by themselves, right? So it's very common um, complaint, kumbaga, pagdating sa large animals, but also can also happen in dogs and cats, right? And lacerations can be superficial, which will only include the skin and the superficial subcutaneous tissue, or deep. All right, deep lacerations will be full thickness, meaning the entire skin has been severed or broken, and the underlying structures. Ano ba yung underlying structures under the skin? Right? You have the muscles, correct? What else? Well, it would depend on the part of the body of the patient. If it's kind of fat, it's kind of fatty patient, you would have the cushion of the adipose tissue under the skin. So the lacerations would not be that bad, but it would entirely affect as well the underlying structures, especially for those areas wherein minimal yung fat cover. Ano ba yung areas ng body ng, for example, the dog, which has minimal soft tissue underneath it? The limbs, yes, because you don't have that much fat covering that area, right? So that's good. The even the face, diba? All right. Abrasion is basically ito yung tinatawag nating gasgas, a graze or a scratch. It can be irregular as well, and it's usually not just one tear-like na wasak agad yung skin. It's usually multiple grazes into the body depending on how it happened, and it would only affect the epidermal layer of the skin. And it is commonly caused by a sliding or fall on a rough surface. Could be pag nadapa ka, yung semento, or a tree bark, okay? That could easily happen. And this would usually, what do you call this? Would not necessitate as much wound management as the other kinds of open wounds, right? Usually this would heal on its own. It would not cause that much bleeding because it will only affect the epidermal surface, and it's very non-vascularized, the epidermis. So not that serious, basically. All right. Avulsion. Okay. When you think of avulsion, pag nakita mo to, akala mo laceration siya. All right. But when you look at it, all right, these are wounds wherein the structures, meaning the skin or the muscles, are traumatically detached from its normal attachments, meaning nandun siya. Okay, as you can see on the picture on the left, you can see that the skin is there, the muscle is there, but it was severed from its attachments deeper to it, right? If the skin is the only thing involved, it's usually called a degloving, and it's referred to as a more severe abrasion, right? Ito yung tipong parang nakatakip pa rin yung nag-break na skin. With the laceration kasi, nawasak talaga siya. Either natanggal agad yung natanggal yung skin, hindi mo na siya mababalik, or the skin was really broken, but you could still see the edges. Magkalayo lang yung edges. All right. Next wound. Oops, sorry. Would be puncture wounds. All right. Ito yung mga wounds na you may not see so much damage on the superficial level. All right. But this is caused by an object or an instrument puncturing the skin. It could be a nail, a glass, a needle, wood splinters. So yung makikita mo sa labas would be just a small wound, right? But the problem with puncture wounds is that it would depend kung ano yung nagpuncture, kung gaano siya kalalim, kung gaano kalalim yung dinaanan ng puncture wounds. All right? So it's harder to assess the damage of puncture wounds as compared to lacerations. Because with the lacerations or abrasions, you could easily see the damage, diba? Nandiyan na siya sa harap mo. But with puncture wounds, you have to, kumbaga, dig deep into the wound to see how much damage was inflicted into the underlying structures just for you to identify how to treat it, right? Puncture wounds are not treated as an abrasion dahil maliit lang yung nakita mo. You have to see the damage underneath. And that usually requires for you to make that superficial wound, yung nasa labas na wound, bigger for you to see what's inside, right? And this is something that is quite challenging to discuss to clients because ang nakita nila, maliit lang na butas, okay? Like this. Okay? But for you to see if there's anything wrong underneath it, you have to, what do you call this? Lengthen that incision like this or like that, just for you to see what's inside, right? Okay. Yeah. All right. Hematomas. So as we have discussed, these are closed wounds, which is caused by damage to the blood vessels underneath it, which could be caused by a lot of things: trauma, immune-mediated disease, um, parasitic diseases, especially for oral hematoma. Parasitic infestations, which cause the accumulation of blood in the subcutaneous space, kaya siya lumulobo. Right? And this could happen with the oral hematomas right there, especially if patients have an ear problem, could be an infection, could be a parasitic infestation, or it could be an anatomical ear problem, like when they have ear stenosis, yung tipong narrowed yung ear canal nila. Some breeds are predisposed to that. And as we have discussed, skin bruises after blunt force trauma could cause hematomas, right? So how do wounds heal, right? These are methods of wound healing, okay? What do we usually do, right? So there is primary intention, secondary intention, and tertiary intention, right? So primary intention muna. Primary intention is how we induce healing of a clean wound with no tissue loss. Okay? Yung madaling pagdikitan yung wound edges, you can easily oppose it with suture materials, staples, or tissue adhesive. And this is the usual method of wound healing for our surgical wounds na hindi naman siya, yung ikaw yung naggawa ng surgical wound, like abdominal incisions, space, castrations, and such, right? And since magkadikit naman yung wound, hindi mo naman binabanat or there's no need for you to, what do you call this? Uh, banat. I'm thinking of the English. So stretch the skin edges para lang magdikit sila. It usually leads to faster healing, less scarring, and also less risk of post-operative infections. Okay? Now, with secondary intention, ito yung method ng pagaling ng wound kapag magkalayo yung wound edges, right? Especially if you have an avulsion wound, you have a laceration na magkalayo yung wound edges na kailangan mong pagdikitin, right? To cover that wound. Usually what we do is that we leave the wound open, right? We do our wound management, do our cleaning, debridement, which we'll discuss in the future lecture videos. Kapag hindi mo kayang pagdikitin with the suture, right? Hindi mo kasi pwedeng pilitin yung balat na magdikit kapag hindi talaga niya kaya. Right? So what we do is we leave it open, okay? And then we leave the wound to granulate. Okay? It will heal on its own. All right? And what do you call this? Usually it leads to a bigger scar. All right? And it will take a longer time dahil hindi magkadikit yung wound edges. Kailangan mong form ulit ng bagong layers of the skin to cover the original wound. Right? And most of the time, okay, I will discuss the exceptions to the rule, is that when we leave wounds open, when we do secondary intention, we usually do wound packing, right? We cover the wound, the entire area of the wound with what we call wound packing materials. Okay? We remove it. Ito yung mga bandages and such. Then we remove it daily. We clean the wound and then we wait until the wound heals by itself. Right? And it happens. The wound, yung wound or yung skin, it will actually contract, meaning it would want to reach the other part of the skin that was severed from it, but it will take a longer time, right? But it is possible. I've seen a lot of conditions like this. And with tertiary naman, it's a combination of primary and secondary. Okay? With tertiary, the wound is purposefully or intentionally left open for 4 to 5 days. And kapag nag-contract na yung skin, just enough for you to suture it, you'll eventually use sutures or other biomaterials to suture it closed. Right? So, sa unang part ng healing process, you use secondary intention. Okay? You clean it, you cover it with bandaging, and then kapag pwede mo nang pagdikitin yung wound edges kapag nagdidikit na silang dalawa, then you could use the sutures. Right? Now, how do we classify wounds? Right? This is usually based on the degree of contamination. Right? Since ang wounds naman, hindi naman lahat yan surgical wounds, diba? As we have discussed. And the degree of contamination would have a very big effect on the risk or the likelihood of the developing wound infections, right? If simula pa lang or how the wound was created was very dirty, especially if it's a traumatic injury, dogs or boars or cats run over or hit by a car would have a very big level of contamination. If that wound was left for a certain number of hours, which we'll discuss in a bit, it will have increased contamination to it. And in some, I think in pathology, we'll discuss infection, inflammation. There's just a different approach in surgery, right? Infection is usually clinically, you'll see the presence of pus, presence of abscess, or a fistula, right? With inflammation, this is an infected wound with more than 3 inflammatory signs. Ano ba yung mga inflammatory signs natin? Redness, swelling, pain, heat, loss of function, but we'll include, with a surgical approach, wound dehiscence, yung call this, bumukas ulit yung wound. Nagtahi ka, and then natanggal yung suture, bumuka, kumbaga. That's wound dehiscence. Or the presence of serious discharge. All right. So these are the wound classifications. You have the clean, contaminated, and dirty. All right. So let's discuss each one. All right. With clean, this is a non-traumatic, non-inflamed operative wound or surgical wound wherein no entry, okay? Hindi ka pumasok sa kung saang part ng body na ganito. Respiratory, GI, genitourinary, and or oropharyngeal tract. Right? Now, examples of these are those surgeries that we do, like elective spay and neuter and XLAP, wherein we just enter the peritoneal cavity, but we do not go into any of the gastrointestinal tract. Okay? Again, no entry. That's clean. All right? Now, clean contaminated, okay? Ito naman yung operative wounds, okay? Again, surgical wounds wherein we entered the respiratory tract. We do a tracheotomy, for example, gastrointestinal tract. We do an enterotomy. We open up the stomach, right? Or the genitourinary tract, okay? And this was made, these are wounds made under controlled conditions without contamination. All right, sorry for that. Without contamination, meaning you're able to employ all the principles of surgical asepsis very strictly, that even if you entered these tracts wherein leakage of the contents could lead to contamination of your surgical area, okay, you were able to control it. So examples are enterotomy, imaging procedures like oscopies, like endoscopies, cystoscopy, rhinoscopies, or cholecystectomy, right, which is still a part of the gastrointestinal tract. All right. And contaminated would be number one, they can be open, fresh, accidental wounds, yung mga lacerations, traumatic injuries. Number two, spilled ingesta, bile, or urine. Or wherein you wanted to start your surgery as a clean contaminated surgery, but there was a lapse in the principle of surgical asepsis or the rules of it, right? So merong na spill, right? Your surgery, the wound that you are that you made is now considered contaminated, or if there's any major break in a septic technique, right? Number one, example, skin lacerations and avulsions are immediately um, uh, classified as contaminated wounds. Fresh dog bites, bile spillage, when you do your gallbladder surgeries, okay? Hindi mo napak ng maayos yung wound, may nag-spill na bile to the abdominal cavity, that's bad. And open cardiac massage, which is a part of cardiopulmonary cerebral resuscitation, right? And dirty, right? Dirty. These are old traumatic wounds with may nana, there's necrotic tissue, you see foreign bodies in the wound like uh, dirt, soil, branches, leaves, okay? You'll see that. I've seen a lot of foreign bodies in wounds. Dirty would also be a cavity with fluid is perforated, right? For example, your patient was your patient is a cat kung saan blocked yung urethra niya. Okay? Meron siyang stones. So, ang laki-laki ng bladder niya. Okay? And then, that was not resolved. That the owner didn't know what to do. They did not go to the vet. So, the bladder burst. Okay? So, that now is a dirty wound. Right? And of course, fecal contamination. Right? So examples of this would be abscess, excision, or drainage. You're expecting a lot of pus in there, peritonitis, and a ruptured gallbladder, which could happen before the surgery. And that's why you're actually doing it, right? So I think I have an exercise here, but since I was not able to make a PowerPoint and present it to a PDF, these are just examples of it, right? So expect the quiz to be like this. So I give you a picture or a condition or clinical case, and I describe it. Then you identify what type of wound that is. Okay, so this is an abdominal incision after umbilical hernia repair, right? So that's clean. Okay, we did not enter any how do you call this, internal organ tract with it. We just replaced them and then sutured it back. Right, next. This is a straight cut on the footpad of a dog after stepping on a shard of glass, right? This dog was presented to the clinic right after the accident. So this is a contaminated wound because, yeah, I know this is where the benefit of a live Zoom would be in, but I lack in that. Sorry. Right? Why is it contaminated? This is a traumatic injury to begin with. All right. And the dog might be presented to the clinic immediately. All right. But we don't know if that glass is clean. We don't know what happened from during transport. So that is immediately classified as contaminated wound. How about this? Okay. This dog was operated on for a tumor removal, went home, but then the dog bit on the sutures and the wound dehisced. Okay. And you can see once it was presented to you, there was pus and necrotic tissue, right? Immediately, this is a dirty wound. Okay. Exploratory laparotomy on a cat with uroabdomen. What do we say? Um, what is a uroabdomen? Okay, the urinary bladder ruptured or there was a hole in it. All right. and or it could be from a traumatic incident, which is the case here, and the blood ruptured, causing the urine inside to spill to the entire abdominal cavity, which is a big problem. You know what is contained in the urine. You know the nature of urine. It shouldn't be near those abdominal organs. It will cause peritonitis. So this is immediately a dirty wound. Okay. Now, enterotomy in a cat after foreign body ingestion, you enforced strict surgical asepsis during the surgery. There was no spillage of ingesta. So this can be classified as a clean contaminated, right? So this is just an example of how the quiz is going to be. And what do you call this? Um, I will give you all the details that you need to identify what kind of wound it is, and then you just pick, right? So let's move on. Okay, how does a wound heal, right? Yung methods kanina is how do we do it, right? As veterinarians, as medical practitioners, how do we approach the wound in terms of healing? But now we have to discuss how the wound heals by itself, right? Ano ba yung mga processes that we need to understand? And uh, this is hmm, this is a big surgical topic, I guess, because I don't know if pathology would or medicine might discuss it, but this is really under a surgery, and this is a common um, question in the board exam. All right. So this is a biological process, meaning it is a combination of physical, cellular, and chemical events which restore the continuity of the damaged tissue. And this immediately starts after injury. All right? Hindi yan naghihintay. Immediately, the body will employ certain mechanisms to, kumbaga, start the wound to heal right after it was induced. Right? So there are four phases. And even if we say phases na tipong step 1, step 2, step 3, step 4, there are some areas of the four phases which overlap with each other. Right? So number 1, the inflammatory phase. This starts from 0 to 5 hours post-injury. Ano ba yung nangyayari? The activation of the inflammatory cells from the entire body would be activated by the pressure and pain receptors, the baroreceptors, nociceptors, where the wound was inflicted. Okay, and they would lead to inflammation. Okay, what happens during inflammation? There is increased vascular permeability. Okay, mas mabilis nakakalabas from the capillaries ang mga inflammatory cells, which it usually cannot, right, in normal setting. RBC and platelet chemotaxis, the release of cytokines and growth factors, and the inflammatory cell activation, right? And it has some parts of it. Number 1 is hemorrhage, right? Bleeding might be, you might think it's just a consequence of the breakage of the blood vessels, but it is also a mechanism employed by the body that you need to bleed it out to clean out the wound and for the wound to be covered by blood so that no foreign bodies out from the outside, no dirt could actually fill it after injury. Okay, it's a way of your body to shield that open wound, which could be an entry point for bacteria, for for microorganisms, and for those contaminants. So blood out of the wound is good for the inflammatory phase, right? And these blood vessels would usually constrict after 5 to 10 minutes to limit hemorrhage naman. Right? And with the vessel dilation in response to the inflammation would also lead to leaking out of fibrinogen and clotting elements. This is a good, I think, I don't remember what episode that was, but it cells at work. You see the platelets there, the cute ones. Yeah, that's a good example of the inflammatory phase for wound healing. Right? So the next one, after hemorrhage, after the bleeding, now you have to form the clot. Right? The clot would stabilize the wound edges, right? If you remember, I don't know if you watched it, Cells at Work is perfect for this. Okay, they have that net across the hole, right? And that would be the first source of the wound strength. All right, this covers the wound. It is a barrier from infection and further fluid loss that you would want to limit. And this acts as the framework or the substrate for early wound organization. The body would want to fix what was broken. All right, it will start these mechanisms almost instantly. All right? Kaya nga sinasabi, yung nagko-cover na clot there or the scab which happens after the clot dries, wag mong tanggalin. Kapag dadapa ka, 'di ba, may nagfo-form na parang black thing there. Don't what do you call this? Do not try to open it even if how itchy it goes. It causes you so much trouble. Um, do not pick it. Do not pick the scab out kasi merong healing na nangyayari sa loob. Alright? So, this dried clot or the scab will protect the wound, prevent excessive blood loss, and it will allow the healing to start and move and progress underneath that surface. Right? And I'm there before I would pick on lampa kasi ako. So, madalas ako nadadapa kaya hindi ako pinapalabas masyado ni mama. Kasi pag lumabas ako, for sure, may dapa akong, meron akong malaking gasgas agad sa tuhod ko. Right? And I would want to pick the scabs kahit yung masakit, kahit feeling ko parang magdudugo. Yeah. And then I learned you shouldn't. All right. Until it's easy for you to remove the scab. Meaning the layers that was severed under the skin, under that scab has healed already. Right. Next one. From inflammatory, we now go to the debridement phase. Right. Depending on the person you talk to, it's debridement. Not a big issue. All right. Duration for this would be after inflammatory phase, 6 to 12 hours post injury. It could last up to 3 days, depending on the size of the wound. And this is when the red blood cells and the platelets will be replaced by your white blood cells. All right. You have the dead tissue and the wound fluid. They would be the appearance of the neutrophils and the monocytes on the injured tissue after injury would initiate the debridement phase. Right? Why is it debridement? What do we mean by debridement? We would want to remove, okay, necrotic tissue, possible bacterial contaminants, possible dirt contaminants. Okay, that's debridement. Right? Tinatanggal natin yung mga yon. So the body uses its own immunological cells or inflammatory cells to start that process, right? The debridement phase can be done by the body and by us, right? As needed, right? We'll discuss this in management of open wounds, right? What do neutrophils do? They increase in number, okay, to prevent infection. You know what neutrophils do. You're done with immuno. And they phagocytose organisms and debris, right? We don't want those organisms to fester in there and cause infection, right? And those degenerating neutrophils, which will be seen as pus, right? They release enzymes and toxic oxygen production or reactive oxygen species, which will stimulate the monocytes, right? The monocytes are the major source or secretory cells of growth factors. And growth factors, if you go through any immunological book, depending on where they go, what part of the body they go, they are there for tissue formation and remodeling. And remember, monocytes, when they exit the blood vessels, they are now called macrophages, right? And they are there, they are found there in 24 to 48 hours, right? Macrophages would also secrete collagenases, right? Dun pa lang, enzyme, collagenase, it will break down collagen. Okay, Doc, why would you want to remove collagen that's there? You would want the collagen to be there, right? But you have to remove first the necrotic tissue. Okay, the area of the wound wherein there was originally collagen and the skin layers is dying. Okay, it was severed from its vascular supply, it was severed from its nervous supply, so they die, they undergo necrosis, and you have to remove that for you to build new tissue, right? So these macrophages, depending on the size of the wound, would also coalesce and form into those giant cells as needed. Kapag maraming bacteria, foreign materials to be phagocytosed, they could unite and form into these big cells, right? And also, they secrete, I already said it, chemotactic, meaning attracting more inflammatory cells and growth factors. So the complement series, collagen fragments, bacterial endotoxins, prostaglandin alpha, growth factor, interleukin 1, and FGF alpha and beta. All right. Next, repair phase. After inflammation was done, you remove the debris with the debridement phase. Now we start repairing, right? And this starts 3 to 5 days post-injury, again, depending on the size of the wound, right? And where it is. And it is composed of subphases, okay? And these subphases would can occur at the same time or can occur just right after another, but usually they overlap. And the repair phase is affected by the tissue oxygen content. Remember, tissues need oxygen, and usually they would get that from blood that goes into in that area. However, if that injury or the wound has severed the blood vessels and it's clotted, it's not there, you have to find a way for that blood and oxygen to get into the tissue as well. Okay, let's start with collagen synthesis. The main, what do you call it, cells, all right, structures that are involved with collagen synthesis would be the macrophages and the fibroblasts. Macrophages would stimulate the fibroblasts to go there, right? And the fibroblast would begin to deposit collagen and other molecules like elastin, proteoglycans, which will later on become fibrous tissue, right? They migrate to the wounds along the fibrid strands, which was made by your platelets, your clotting factors, 3 days post-injury. Okay, they would synthesize they would form and deposit collagen, elastin, proteoglycans, which will later mature into fibrous tissue, which is which is tougher. And initially, they would deposit this collagen in a very haphazard manner. Walang organization. Okay? Basta patong-patong, basta mag-repair tayo. Kailangan niya ng collagen. And then, this orientation will undergo a conformational change, which will become parallel to the wound. And this would undergo around 2-3 days, right? Provided that this was not stopped, if you did not pick on that scab, if there was no other more injury that was done, if the patient was not self-mutilating itself. So if these things are not happening, then the repair phase would just continue on and on and on. Right? So the wound fibrin, yung original framework, original platform, call this, kumbaga yung beams, okay, na nag-hold sa bahay, right, usually appear. Then napapalitan na siya ng collagen, which is usually what yung mga hollow blocks. All right? So increased collagen amount in the wound would also be observed with the decreased number of fibroblasts. Okay? Basically, hindi na siya kailangan, nawawala na siya doon. Right? So next, angiogenesis. When we say angiogenesis, we have to form new blood vessels to supply the area of the wound na dati na nawalan ng source of blood flow. Okay, and what are the stimuli for this? Okay, it doesn't just happen because it needs to. Okay, number one, the macrophages would also produce or secrete angiogenic factors. The most important or significant of this would be the vascular endothelial growth factor, or VEGF, right? This would basically be the stimulus for it. Number two, low oxygen tension. The tissue needs or cries for oxygen. Again, the body listens. Okay? And of course, increased lactic acid. We don't want to go back into your official, but you know why increased lactic acid would be a stimulus for that, right? And blood vessels doesn't appear ng bigla na lang magkakaroon ng parang straw-like vein or artery there. They usually start as capillary buds, right? They start and they will sprout from a intact blood vessel, right? And the endothelial cells would slowly migrate toward the wound, and these endothelial cells will form the new blood vessels. And of course, when we talk about arteries and veins, we have to talk about lymph drainage. Okay, they would develop similarly, like blood vessels, but they would be a little bit slower. Right now, next would be granulation. Okay, granulation tissue, this is formed by new capillaries, fibroblasts, and fibrous tissue for open wound. Ito yung pag nakikita mo na yung wound na malinis, it's red, it's well vascularized, it's fleshy. You see that very good laman there. So the subcutaneous tissue. You want that, okay? You want it to look like this, okay? Because this one is unhealthy. Why? It's white, meaning it's not vascularized. Okay, it has a poor vascularization. It's high, it has a high fibrous tissue content, but not healing properly. You cannot have high fibrous tissue content with no vascularization. We're not forming a cartilage here. We're forming flesh. We're forming skin, and that's no good, right? And a good granulation tissue would also be a good barrier to infection. Okay, it's a surface for epithelialization, which will happen later, right? And this good granulation tissue, this laman, okay, this is basically a layer that you see there, okay? This is the source of the myofibroblasts. Okay, and this contains the myofibroblasts would contain actin and myosin because remember, muscles underneath the skin are not just the muscles that we can identify. You have superficial skin. You have those skin that are attached, basically directly attached into the dermis and subcutis, which you have to sever during like surgical wounds, right? So these myofibroblasts will be call this the beginning or will form those small superficial muscles. And this is not present in normal tissue because there's no need for them. Next, epithelialization occurs 24 to 48 hours after granulation, okay? For sutured wounds with good edge apposition, because basically it happens really fast, right? This is energy dependent and affected by oxygen tension, right? Kaya sinasabi, huwag mong takpan. We'll discuss this in a bit. Management of open wounds. Hindi pwedeng takpan lang ang sugat. You need to let it breathe because it needs oxygen. And that is true. There is a logic to that. All right? Because certain processes of the repair phase require oxygen. And until the blood vessels are really good, okay? Blood vessels are what do you call this? Fully formed, okay, on that injury. The wound would be deprived of oxygen. Okay, so you have to let it breathe. Okay, epidermal cells would be formed here. They migrate through, they would travel here. They would migrate through the collagen fibers that was created during in granulation phase. And they are mobilized under the scabs and they produce collagenase, which dissolves the base of the scab. Kaya, madali mo nang matanggal yon at hindi na siya masakit, right? Kapag meron ng epithelial area sa ilalim. Okay, and this would be the basement membrane of your wound. Okay. Now, in suture wounds, remember, or with the staplers, right? Suture tracts may be epithelialized, okay? Meaning there could be the formation of the basement membrane or epithelial tissue through yung dinaanan ng suture mo, okay? So, you don't want that because the body would detect, oh, this is something different. This is not normally in the body, the suture, okay? And this could cause the inflammatory cells to be activated. They will attack that, and that will cause infection and inflammation, right? So this is why we remove sutures, especially we call it non-absorbable sutures, which will stay there for quite a while. Okay, and this is scheduled at 7 to 14 days, right? Because usually epithelialization would happen right after that. Okay, so we have to remove those to let epithelialization occur ng mas maayos, mas mabilis. Okay, next, wound contraction. Okay, the wound edges would move towards each other. They would, all right? That's the tendency because you nag-form na yung granulation tissue, you're forming new skin in the middle of them, right? So they would basically contract. Okay, this is when the collagen would reorganize, and when the collagen reorganizes, and remember, collagen would be your base. Kaya may hatak yung skin. Okay, this is because of the collagen. So they usually move towards each other at a rate of 0.6 to 0.8 millimeters per day. This was from a research study that they did. All right, and imagine just 0.6 to 0.8. That's pretty fast, ba? And this process would stop when the wound edges meet, excessive tension is present, meaning the tension in the skin is back, okay? Inadequate myofibroblasts would also do it. And this is limited by skin elasticity, tension, and impaired development and function of the myofibroblasts, which could be affected by a lot of things. Age, we'll discuss this in a bit, but this is affected by the patient's condition itself, right? Oh, here we go. NSAIDs. The use of NSAIDs could impair wound contraction. All right. Again, why? This is a non-steroidal anti-inflammatory drug. So basically, its goal is to inactivate or to stop inflammation. And there is still that migration or that activation of certain cells and growth factors and the secretion of such growth factors, which enables wound contraction to occur. So usually, when we are treating a wound patient, all right, we steer away from NSAIDs as a analgesic. All right. Steroids as well. It's same mechanism of action and the local application of smooth muscle relaxants. Remember, you want your muscles to move. You want the muscles that the myofibroblasts are making to move towards each other, right? Para mag-contract yung wound. You do not want for those smooth muscle relaxants to be inhibited from contracting, right? Di ba magtaka ka, hindi siya gumagalaw. Malamang naglagay ka ng ano ng lidocaine for the pain. So you have to explore other ways to manage the pain of a patient. And this is actually a very big problem in the veterinary industry in a lot of countries in Asia because a lot of analgesics are controlled. Okay, the good analgesics are controlled because they're very prone for addiction or misuse of people. You have the opioids, and you have the opioid epidemic, which affects a lot of people around the world. So there is a reason why Food and Drug Administrations all across the globe would also restrict that from veterinary use. They limit the how you buy it or even limit the sale of it. So it's very hard. Like for example, my go-to opioid drug for patients would be methadone. Okay, full mu agonist is very good. You don't need that much. Very low side effects. It's very good, very potent. But you cannot get as much of it in the Philippines as compared. You can get it like in the U.S. or in Australia or in the UK. Okay, because they can be used excessively, right? Number two, another ketamine, fentanyl. Okay, I think you've heard of these drugs as well, and they're quite controlled. So ang hirap. Okay, now last phase would be the maturation phase. This is 17 to 20 days post-injury. Duration may take years. Okay, but why? What happens here? Why is it taking years? This is activated or it begins once the collagen fibers are adequately deposited in the wound. Okay, and there's a lot of things happening here with the collagen. There's increased cross-linking of the collagen with each other. The collagen fibers mature, meaning they become tougher. Okay, there is decreased cellularity, nawawala na yung mga cells, maybe inflammatory or non-inflammatory in the granulation tissue, and there is decreased collagen content in the extracellular matrix. Okay? Dahil nag-move up na sila dun sa skin area. Okay? Now, there is a slow increase in the tensile strength depending on the maturation of the collagen fibers. The maximum is 80%. Okay? Usually, that's the only amount of tension that you could get. Kapag nasugatan ng skin, basically, it will not return to its 100% what do you call this? Normal function. Lalo na kapag malaki yung wound, I don't know if you have this, like for example, you got bitten by a dog and your wound only healed through secondary intention, which is usually how it happens. You'd see that meron siyang lamat, meron siyang area where you see the original wound. That is not as strong as intact skin, right? It will usually just go up to 80%. It will do the job. It will remain as a barrier from infection. You'd see the wound would be closed, but the tensile strength of that skin would not be as strong as the skin itself, right? And scars become paler since, of course, there will be decreased number of capillaries, which will be more concentrated now into the dermis. right? Host factors affecting wound healing, right? Number one is age. Old animals tend to heal slower as compared to younger animals. Why? Number one would be your total body water content, okay? Younger animals would have a better body water content, so usually their circulation would be better. Old animals would have, of course, the usual senility process, wherein the immune system and any other system would usually depreciate in value. Kumbaga, hindi na siya ganun kalakas. Right? They're not as good in protecting the animal from infection. So usually the wound healing would be not as good as in young animals. Nutrition, of course. Your collagen fibers, your myofibroblasts, all the processes that we have discussed is based in nutrition. Your body would not be able to mount the certain level of we call this fight and defense from outwardly um, call this things, right? They do not have good nutrition. Okay. Malnutrition, decreased serum protein, which could be less than 1.5 to 2 grams per deciliter, that could delay the wound healing. It doesn't mean that it will not heal. It will just heal slower. And when the wound heals slower, there is a higher risk for it to be infected while it's healing, right? And the scab or the wound the wound matrix that it will form will not be as strong as in good, well-kept dogs and cats and large animals. And disease, of course, hepatic disease would immediately cause your patient to undergo low protein in its circulation. Hyperadrenocorticism, diabetes mellitus has been pointed to be um, well, this cause of a retarded wound healing and bleeding disorders. This would immediately affect your inflammatory phase. All right. So that is it for the first lecture of wound management. I am posting this with another lecture video, but make sure to, I hope you watch this first. Okay. And we will be discussing more about wounds as we go. I think one more week, 2 more weeks until another exam. And actually, your SEM will be done. Yes, yes, I like that. I like that too. All right. Keep strong, everyone. Thank you for listening to me. I know you can't see me, but I can't see you either. So fair play. All right. Expect the quiz a day after I posted this one. All right. But that will be available for until next week, Friday. Okay. Before our next lecture. All right. Thank you. Check out the next video and I'll see you soon. Bye.